much, Jamie. Bonjour à tous et merci d'être venus ce soir. I'm really excited about the story we have to share with you this evening. We want to tell you about a great city building project that we have been anticipating for years. And with your help, we will soon begin the journey to create the best healthcare facility in all of Canada. Ensemble, nous commençons un projet formidable pour donner les meilleurs soins de santé au Canada. But first, I do want to thank Catherine McKenna and Yasser Nakvi for being here with us this evening and for their support in bringing our vision closer to reality. Mayor Watson had to send his apologies, but I want to acknowledge his support for what I believe is the most important city building initiative that our community is undertaking. A special thanks to our members of Parliament, members of provincial Parliament, city councillors, public servants, and business leaders for being with us this evening. I would be remiss if I didn't recognize the support of my board chair, Jamie McCracken, and all the members of the Ottawa Hospital Foundation Board who are here this evening. Members of the Ottawa Hospital Research Institute Board and the Ottawa Heart Institute Board are all here as well, so thank you for your endless support. The leadership from the Champlain WIN, you've met Chantal Leclerc, and the Heart Institute, and our health partners from across the LHIN have been highly supportive, and I want to thank all of them who are here tonight. And of course, none of this would be possible if we didn't have, in my unbiased view, the best hospital staff in the entire country. Thank you to our doctors, nurses, other health professionals, researchers, and all the support staff for taking the time to be here. And finally, a special thanks to all of you, our community members, for coming here this evening. I know that everyone has to juggle work, family, and private life. So once more, thank you all for making the time for us. Ce soir, nous répondons à beaucoup de vos questions. We will answer many of your questions. We'll address some of your concerns and hopefully begin to build the partnership and trust that is essential to creating one of the finest 21st century healthcare facilities in all of Canada together. This is our first public information session, and I anticipate that we may not get through all your questions this evening. We will soon follow with a more robust consultation program. In the meantime, you can go to our website to ask questions and receive updates. Now, before I take you through the exciting vision we have for our new hospital, let me begin with an apology. First, I am sorry that it has taken so long to get to this event. I could offer you a long list of reasons why, but I won't. I will, however, thank you for your patience. Second, I want to apologize for allowing the issue of where we build this great new hospital to almost overshadow the far more important question of what we are going to create together. Where we build is really important because at the Civic, we treat the most acute patients in the National Capital Region, where minutes really do matter. So we must build our new Civic where it makes the most sense for the most patients, on a site that is accessible to highways and transit, in the heart of Ottawa, and where a great hospital and a health village can flourish. I am sensitive to the concerns that have been raised about the experimental farm, and I assure you that we are working with the federal government and the city to address those concerns. I'll be pleased to answer any questions you may have about the potential sites during our Q's and A's that follow. But tonight, I really want to focus on why we need a new civic campus and how our stakeholders and experts in 2008 identified the site, the farm, as the highest rated location for the new campus. and I also want to touch on the current review to assess other potential sites in our city core. So let me begin where we are today. Today we work out of an aging, early 20th century hospital. A hospital built to earlier standards, very different standards. One that no longer allows us to be the best we can be and to deliver comprehensive and integrated healthcare. A 21st century facility will enable us to deliver safe patient care and do it more efficiently. It will also serve as a hub for an integrated network of health and healthcare services. It is really the heart of the modern approach to healthcare in the 21st century. Let me try to sketch an outline of our vision. You will have the best care in the comfort of a private room filled with natural light.
New Civic Campus.
Every patient will have their own bathroom, which is critical for reducing hospital-acquired infections and promoting recovery with your family and friends in the privacy of your own room. Isolation rooms, modern materials, flexible floor layouts, and monitoring systems will help us defeat superbugs and repel viruses and drug-resistant bacteria. Diagnosis and surgery will be done in tandem in the same operating room suite. We will save precious minutes treating strokes, heart attacks, and major trauma. Every minute saved can mean the difference between a good outcome and a permanent disability, even death. Your new hospital will be fully digitized. You, your family, your caregiver will have real-time access to your up-to-date health records from anywhere in the world. We will continue to be a center of excellence for groundbreaking research and discoveries that lead to better treatment protocols that will benefit our patients first, then the patients across the country and around the world. Today, we have a very committed and caring staff, and I hope you got to meet many of them this evening. They work hard to ensure that you receive the best care available today. But they do it in a facility that was first opened nearly a century ago. Our aging buildings need constant renovation and repair. And despite this ongoing patchwork, we have parts of the hospital that must be closed permanently. They're literally too unsafe to use. And at only 23 acres, our facilities are squeezed onto a site that is just too small. Our emergency helipad is situated across Carling Avenue. When a helicopter lands, our most critically ill patients have to be transferred from the helicopter to an ambulance. The paramedic has a key that allows them to turn the traffic light to green so that the ambulance can safely cross Carling Avenue and then drive a few hundred feet to the emergency department on the main floor of the Civic. From the emergency room, those who need an MRI must go across the hospital and up a floor to the first floor. And then, if required, if they need critical care, they go up another floor to the intensive care unit. And if they need to go to the OR, it's over on the third floor. All of this in one of Canada's largest trauma and acute care centers, where minutes really matter. Today, academic hospitals, university hospitals, like the Ottawa Hospital, face stiff competition in attracting and retaining the best talent in the country. The best doctors and researchers and the largest share of research dollars flow to leading-edge facilities. Our researchers today struggle with space and equipment to meet international standards. And just like any other healthcare facility in the 21st century, infection control is a battle we wage daily. Now, I want to be clear. Our staff are exceptional at dealing with their aging hospital. Our performance, our quality for door to treatment times are as good or better than other hospitals in the country. But imagine how frustrating it is for our professionals to know that with a modern facility, they may save more lives and limit suffering. The core of our vision is really simple. The best facilities, the best professionals, delivering the best care, not just on opening day, but for a generation. I am really excited about this because if you look back, this might be a once-in-a-century opportunity to create the future of healthcare in the National Capital Region and the Champlain-Lynn, and we do that together. Today, the Ottawa Hospital serves a population of 1.3 million people across dozens of communities in Eastern Ontario. We serve more patients and their families than any other hospital in Canada today. And the demand for the best possible care is growing really fast. Our aging population will put tremendous strain on our health system, and it's already started. We will simply not be able to cope without newer, safer, and more efficient facilities to deliver quality health care. We are proud of what we achieved today in a facility, parts of which date back to the Great Fire on Parliament Hill at the turn of the last century. But we want to continue to be the best we can be, a leader in patient care, in research and discovery. So we began our planning almost a decade ago. We created a master plan for 2020 and beyond. In 2006-07, we convened a planning committee made up of the region's top healthcare leaders, medical professionals, and community leaders to help us with our planning. The committee recommended that the Ottawa Hospital of the Future should continue to be a 3-site model. The Riverside campus will expand its ambulatory programs on site. The General campus, which is 40 years old, will expand existing services, including a major cancer center, thoracic surgery, transplants, high-risk obstetrics, and the Eye Institute. And the Civic Campus will continue to be the major trauma center and acute care center for the Champlain-Lynn, and will deliver acute care in neurosciences, vascular surgery, and cardiac care, co-located with the Heart Institute. Many of you may recall that in the mid-90s, prior to the Health System Restructuring Commission's merger, health experts recommended demolition of the Civic Campus. It was deemed to be too old to restore and rebuild, and that was 20 years ago. You won't be surprised then to learn that in 2007-08, the Planning Committee did not recommend rebuilding the Civic Campus on site. It would create unsafe conditions for patients and disrupt our staff. It would take more than 20 years to complete, and all of this at an additional cost of about $800 million. The Planning Committee then engaged a panel of key stakeholders and experts to identify potential sites for a new Civic and evaluate them against a list of 12 criteria to determine which sites would best meet the healthcare needs of the community, the citizens of Ottawa, in the 21st century. We needed 50 to 60 acres. We needed to be close to the city center. Our patients and ambulances needed multiple access points, and we needed to be close to the Queensway and public transit. After a comprehensive review that took over a year, the Carling Avenue site scored the highest in the city core. We reported our panel's recommendations to the federal government in 2008. Of the dozen sites that we assessed, 11 were federally owned. So we needed their agreement to secure a site, and we were informed that our request would be considered. In 2012-13, we again asked the federal government for an update, and we were told that a process was underway, but it would take some time before a decision was made. We were subsequently asked to provide information to government to help inform their decision on the land. And in November 2014, we all learned that the site across the street from our existing site would be transferred to the NCC and leased to the Ottawa Hospital for a new civic campus. We were delighted because with a site, we could now begin engaging our community on design and vision for that 21st century hospital. However, we then learned that the process for the land transfer may take up to a year. And towards the end of that process, we learned that the location of the hospital was a concern. Because of this, and the fact that our site selection was actually 8 years ago, the federal government has undertaken a review of potential sites to determine if any changes have occurred and whether those changes might influence site selection today. We are working closely with the federal government and the city to provide more up-to-date information on 4 potential sites in the city core. The Sir John Carling parcel, which is at the northeast corner of the experimental farm, Tunney's pasture, the original parcel of land on the northwest corner of the farm, and a modified version of the original parcel. As we will be long-term tenants of the federal government, we are working diligently with them to finalize a site. Our overarching goal has not changed. We remain committed to provide the best healthcare possible to the citizens of the National Capital Region, not only for this generation, but for generations to come. Now, I want to finish with the what. What our new campus in the heart of Ottawa might look like. Hospitals of tomorrow will be built for flexibility in design, and I'm not referring only to the facility. Together, we will plan how best to integrate the hospital into our community and how to connect to our health partners in long-term care, palliative care, and in the growing home care and community networks. Our planning process will ensure that we work closely with our neighborhood residents, businesses, and other stakeholders. We will deliver community benefits tailored to your goals. It will be a design that is respectful of and in sync with the community, built to human scale and integrated with the natural landscape, not a tower and a parking lot. A design that is at the heart of a neighborhood, not glass and steel standing in isolation. It will be linked by walking and cycling paths connected to healing gardens and therapeutic gardening centers with quiet places for reflection. And the 21st Century Hospital will be future-friendly, meeting the highest environmental standards. Imagine a facility designed to deliver wellness and the speed recovery in buildings full of natural light and blended with its community. A 21st Century Hospital is about leading-edge patient care and cutting-edge technology, research and discovery. But it's also about neighborhood-scale urban planning. And it's part of a trend that promotes healthy buildings and healthy communities. And all of you will be able to provide fresh ideas into what our 21st Century Hospital will be, so that everyone, patients, visitors, neighbors, and residents of the National Capital Region will find benefits and comfort in their new hospital that has been designed to be an integral part of our city's fabric. Tonight is the first in what will be a very lengthy community discussion. This will be a long journey together, but I hope that you are beginning to get almost as excited about your role in helping us achieve our vision. Let me leave you with this closing thought. We are building a new hospital, not only for our generation, but for our children and their children. As Jamie said, several days ago at the Civic, I became a grandpa for the first time. This incredible milestone in my life and that of my family put this new hospital into a very real and personal perspective. The next generation is counting on us. Merci encore une fois pour votre participation, and I look forward to working with you. Thank you.